Sway Health.
Hello, Colin Hung here for Sway Health, and I am in lovely Kiowa River, South Carolina for the E3 Executive Summit hosted by Kyruus Health. Now, this video is sponsored by Kyruus Health, but they've had no editorial input into this video and have not seen it prior to it being published. Kyruus's goal for this summit is to bring together key stakeholders from the healthcare ecosystem, including payers, plans, providers, and patients, to discuss the tough challenges that the industry is facing. It has been a great summit. One of the things I really appreciated about E3 is how each of the speakers brought a really different perspective. There were some who were patient experience leaders at provider organizations. There were people who were CIOs. There was people who worked at plans and at payers. It was really nice to hear all the different perspectives around the same challenge, which of course was access and providing better care to patients. Here are the three themes that emerged for me during this summit. Theme number one, data. We need to empower people with good quality, relevant data so that they can make the best decisions possible. Now, normally when I talk about this is in context of patients, but here at E3, it was brought up that clinicians and plans need access to good data as well. All of the panelists here at E3 talked about the need to get serious about using good data to improve patient care. Theme number two, patients and clinicians need more control. Now, having the right data is part of that, but there's a lot more that's needed. Clinicians and patients need to have systems and processes in place that support them rather than work against them. And right now, being a patient and being a clinician is like swimming upstream. It's exhausting. Theme number three, we aren't going to solve healthcare's challenges, especially access to care, by continuing to add more and more, meaning more tech, more data, even more staff will not do it. It was brought up by a few of the panelists here that simply adding more bodies only to burn them out is really not going to help anybody, right? We need to fix the workflows, the system, the sharing of data. We need to address some of the fundamental problems. And by taking away administrative tasks, by taking away burdensome things from the individuals who are providing care.
Hello, my name is Otto Angulo. I'm a senior director at Atlantic Care healthcare system in South Jersey. E3 has been great for me. I have been able to connect with other peers from the industry, as well as understand the roadmap of where Kyruus is going and build a better roadmap for my team as well as their team and how to work together.
Hi, I'm Tom Pasak from Central Maine Healthcare. I'm the Vice President and Chief Digital and Information Officer. And the E3 conference here from Kyruus, I've learned quite a bit, a lot about partnering between the health systems, providers, and the payers. And I think that's going to be the wave of the future, because in order to really dig into this data that we have, all this rich data between the two providers and payers, we'll have a much better view of the patient and be able to better take care of their needs, especially in the new generation of AI. And I'm really looking forward to the possibilities once we're able to do that collaboration and sharing of data.
So we thought we'd go back to the beginning, right, and bring together a small group of folks to, again, begin to have some of these very real conversations today. So the themes that stuck out to me, I think the biggest one, Colin, is that the problems we're trying to solve in healthcare right now are too big to be solved in silos. Right, and so if you really are going to coordinate care for folks that might, begin a search on a search engine, access their payers, directory, but ultimately book in with a provider, you need to be working across all of these different stakeholders. Things that cause friction, like prior authorization and all the rest of it, we have to start working together, and I think that was, one of the things you heard loud and clear today.
There were some very interesting statistics and quotes that were shared here at E3, and I want to highlight just a few of them for you. This was one of my favorites. One person said that misalignment and financial friction define the current status quo in healthcare. I think a lot of us can agree with that statement. Another panelist said that prior auth has an outsized negative impact relative to other interactions in healthcare. Again, I don't think anyone will argue that statement. An interesting trend, and maybe a bit worrying, is that one of the panelists here basically said that already burdened providers are rethinking their Medicare Advantage contracts. And that's because of something that was very interesting. They shared a statistic that basically said that it costs $47, almost $50, in administrative costs to process a claim denial for a Medicare Advantage program versus only $1 to do the same for regular Medicare. I want to close off by saying thank you to the team at Kyruus Health for inviting us down to cover the E3 event. It has been very educational, and I have to say, it's very rare to be in such a wonderful, lovely, picturesque venue for this type of healthcare event. It certainly helped to be able to look out the window and see such a serene surrounding, and as a result, I think all of us here at E3 learned a lot. I'm Colin Hung for Sway Health here in Kiowa River, South Carolina. Thanks for being here, and I'll catch you on the next video.